Hi everyone. Today we will discuss the most important and very common disease, that is head injury. So, head injury is also known as traumatic brain injury, in short TBI. That is an insult of brain that is not of a degenerative or congenital nature, but it is caused by an external physical force that may produce a diminished or altered state of consciousness, which result in an impairment of cognitive abilities or physical functioning. Like TBI, in short, is not caused degenerative or by congenital. It can happen in any stage of life, either it is 10 years of age or 70 years of age. So TBI results in change in of level of consciousness that also hinder our impairment of cognitive abilities. Like as we know, what are the cognitive abilities? Like function, eating, daily functions, daily house chores, etc. Your activities of daily living or the physical functioning of our body. So it can also result in the disturbances of behavioral and emotional functioning. That mean head injury not only cause impairment, it can also change the behavior of the person or the emotional status of the function patient. These impairment may be either temporary or permanent, depends on the level of injury, and cause partial or total functional disability or psychosocial maladjustment. So next comes to the causes of head injury. So most common cause, as we know, RTA, that lead 50% of head injury, road traffic accident. So as most of you know, wearing helmets, tying a seat belt is important for the life because it could prevent head injury or injury. So second cause is falls, that is from fall from height, that leads 21% of head injury. Next, 12% of head injury caused by assaults, physical assaults and physical violence. And last 10% could be happen by sport injuries and recreational injuries. So comes to the classification, it is divided as three category. First category is by mechanism. If we will discuss about the mechanism, it is closed and penetrating type or open type of head injury. If we will discuss about the severity, it could be mild, moderate and severe, depends on the GCS scale. And if we will talk about the morphology, it could be divided into skull fracture and intracranial lesions. And intracranial lesions further divided into focal and diffuse lesions. Focal intracranial lesion is further divided into epidural, intracerebral and subdural. That is, epidural is above the dura, intracerebral is between the cerebrum and layers, that is meninges, and subdura is between the subdural spaces. And if we will talk about the intracranial lesion diffuse type of head injury, that is concussion and DAI. DAI is diffused axonal injury.